the first line of defense when it comes to taking care of the patient, when it comes to making sure that patients are entering disinfected rooms. One of the ways we have adjusted is we use our CEO's theme, which is firm but not fearful. We focus a lot on the retraining, educating our employees about the COVID virus, and making sure that we follow the standardized cleaning. The process is the following. We did a video with nursing and we asked them for their support that whenever a patient is discharged, that the room is disinfected, making sure that we spray anything that is a contact point, and we got a lot of support from the nurses. And the next step is we go in and we start our regular cleaning process. We treat these rooms as isolations. That means that we have to gown up, but also we make sure that we follow our 7-step cleaning process. The final step that we use when it comes to sanitizing a COVID room is using the Clorox 360. This is a machine that the way it works is it creates a static, and when we spray the disinfectant into any surfaces, it will adhere to any surface. And doesn't mean that we will not disinfect the room with our usual process, but this is one more step that we take. The way I've seen the UMC culture shine during this crisis is because every department has stepped up and shown support to not only EVS but to one another. An example of this is nursing. They have taken up on themselves to learn how to disinfect more often the areas, and that is one of the ways that I've seen this culture shine. But also I've seen many other departments. I've seen food and nutrition. Food and nutrition has brought also treats for UMC employees. This culture is just based on trust, loyalty, respect, and that is something that is making this organization shine.